Welcome to the Parkinson's Diner, presented by Dr. Amber and Victor Van Laar. The topic today is gloves, spoons, and more, gadgets galore. I always think of Go-Go Gadget. Okay, thank you, Dr. Van Laar. Take it away.
Oh, thank you. So yeah, today is a little different. We're going to be talking less about drugs and medicines and mechanisms of Parkinson's, and talking more about some gadgets that can help people get through the day. So first, very important disclosure. This is meant just to purely be educational. We're not going to be recommending or promoting any of the devices we're talking about, and we're certainly not talking about all devices that are available. So be sure to talk with your doctor about any devices. This is just so you can learn what's out there and how they work. So how can wearable technology help Parkinson's patients? Well, when we talk about wearable technology, what we're talking about is non-invasive, drug-free, and even in some cases, completely battery or wireless-free options, wearable options that can help patients manage their symptoms, help patients get through the symptoms, or document symptoms. So this can include mitigating symptoms or overcoming symptoms, like being able to do tasks despite having a tremor, alleviating symptoms. There are technologies coming out that can actually help decrease tremor, or at least alleviate the symptoms for a small period of time. And one of the main areas that wearable tech is moving into is being able to monitor patients' symptoms. So monitoring symptoms is very crucial, not just for doctor-patient interactions, so that doctors know how the disease is progressing, what symptoms you have. It's also absolutely critical for being able to assess disease progress and symptoms when it comes to clinical trials, to be able to tell whether or not a new therapy is working. So these are the things we're talking about when we talk about wearable tech for patients. So I'm going to go ahead, if there's no questions off the bat, and just talk about those three different categories. And we'll start with tech for helping to overcome symptoms. And some of this tech can actually be pretty low-grade tech. For example, something as simple as using weighted utensils. These would be, forks, knives, spoons that have a very heavy weighted handle. And just that weight and the large grip, having to manage that weight and wrap around the large handle can help reduce some people's tremors, because it's focusing the muscle use of the hand and the arm. And this can, for some people, especially those with milder tremor, this can make it a lot easier for the simple task of eating food and getting the food from the plate to your face.
Some of the size of the handle, though, too, if there's problems with dexterity, so using your hand, this is another reason to try something like this. I just wanted to add is sometimes the weight can actually make it harder for some folks. It can actually bring out the tremor, but there are ways of kind of like playing with this to see if it would help or not. So you can actually try this at home and see if it's going to help. But sometimes it's just the size of the handle alone that can be really helpful.
And they have, this is just one example that I have.
Yeah.
There's literally hundreds. Just go to Amazon. Like, there's hundreds of shapes, of sizes, of weights. There's ones that have bent handles for people that can't hold steady vertical. There's ones where you can adjust the pivot of the utensil from the handle. So, if you think this might help, it's worth a try. But the next generation of this would be actually utensils that respond to the tremor. So in this case, we're talking about utensils like the Liftware Steady and the Gyno Spoon. These are Gyno Spoon. I think it's Gyno Spoon. This is for gyros. And these are the two main devices. There's actually a whole bunch of companies have released ones like this now. These are the two main ones that probably work the best from what I've seen. And the way that these work is they actually have, little mechanisms, little servos inside for being able to adjust the pivot of the spoon or react to a tremor and keep the actual spoon or fork steady as you're moving it. And these are just two really quick videos to show examples of how that can work for somebody with a moderate to severe tremor. So no matter how much the hand is shaking, the spoon responds and is able to stay level. So some people have reported that these are very beneficial for them, especially during off periods or for tremors that just can't be controlled. So these are options that are out there. And you can just buy these. These don't require prescription or anything.
I would be curious to know if anyone's tried this. If you want to say in the chat, I'm just this. I think had about a lot of popularity maybe 5 or plus years ago, and I'm assuming some folks have maybe had an experience with it. I'm just curious.
And there's lots of videos on YouTube comparing these two brands, which are pretty interesting. So again, I'm not recommending one over the other, but if you haven't tried them and want to, check out what you can find online and see what you think. And we're not just talking about tremor. We also have other movement symptoms that can be overcome with simple non-invasive cues. One of the main ones being shuffling gait or freezing gait. And there are lots of products out there now that incorporate visual or audio or visual and audio cues for quite literally helping patients take the next step. So one example of that are these Pathfinder laser shoes. And so it's actually just a laser you can strip onto any shoe. The shoes don't come this way. And the idea is that they will project a small visual cue, a little laser line in front of the opposite foot. And being able to look down at those, you're watching your feet, and it's just a visual cue to take a step towards that next step. In a similar vein is the Gait app from Android. This is meant to be marketed with Android's smart glasses, which have not been that popular. So not everyone probably has these, but it's simply an app that projects lines onto the floor in the glasses, so it looks like there's a visual cue for walking. So very similar, but one is an actual laser line, the other one is just a virtual line, but also requires the use of these virtual reality glasses. And then
You don't have Logitech.
this has actually been something that's been
Speakers.
used
Those are real tech.
clinically for quite some time, and that's being able to put like a laser or laser pointer onto a walker or wheeled walker stability device to be able to walk towards that point. The next stride is taking that an extra step, where it's a device that can strap onto the walker that uses both a laser for a visual cue and pairs it with an audio cue. So the idea being you can train the brain to respond to one or the other or both to aid with walking. So these are just a collection of ideas of things that are available. Again, there's tons more. I was just getting some of the main ones out of the way that can help deal with symptoms through non-invasive ways.
I just to add in a little bit, we've actually tried some of these devices in the clinic with people, and I think it really helps, especially for it's not everybody has issues with gait hesitation, so where you just take a little extra second to get going. But this is actually a really great way to help overcome that. And adding in the auditory cue on top of that, the science behind it is very good. And this is very similar to the idea of, there's actually some work that was looking at listening to music and trying to walk, or even thinking about a beat in your head while you're trying to walk can actually help people overcome sort of the Parkinson's just tends to hold everyone back and still, stiff and slow. And the music really helps to overcome this. And I am guessing many people on this call have personally experienced some of the benefit this way. But this is a great, easy to use way to have it on you at all times. So that, again, really to help overcome freezing and that start hesitation. So when you first get up and need to get moving, these types of devices can help with that.
And yeah, so the science behind this is not all that different from, the evidence that patients that have very severe gait and motor issues can jump on a bike and ride a bike perfectly fine. It's this idea of basically hijacking another pathway in the brain to get around the issues that are causing the movement disorders. But the thing with all of these is they're just ways of getting around the symptoms. They don't really treat any of the symptoms. They just help the patient manage them or manage life with them. So, oh, go ahead.
Well, I was going to say, sometimes, the medicines don't address some of these symptoms or not well. And so, though, levodopa is really good for a lot of things. Sometimes it doesn't help some of these other issues. And these are, devices and aids to help with bridge the gap, let's say, with what the meds can and can't do.
And that's the best way to put it. These are aids. So, this is not instead of meds. These are largely in addition to. But that then brings us to our next class of wearable tech, and that would be tech that actually can help alleviate motor symptoms, primarily tremor. So there are several different classes of wearable tech that have been designed specifically for alleviating tremor, or at least mitigating the tremor to the point where it's not interfering with movement and daily life. And one of them that I find interesting is this idea of energy dissipation wearable tech. Now, this technology uses what's called a tune mass dampener or tune mass damper. Basically, it acts to counteract the tremor. This is the same technology that's used to stabilize buildings, skyscrapers, and bridges so that they don't wave in the wind or during earthquakes. It simply is a device that helps dampen the energy from the tremor and basically evens everything out. Now, the thing that's really cool about this is that it's purely mechanical. There's no batteries, no wires, nothing you charge, no apps you have to use on any smart device. It's just a mechanical device that you wear that helps dampen down the tremor. And there are several of these that are currently on the market. This one, the first one that I show here, hold on, let me see if I can get a laser pointer up. Called Tremolo, uses spring-loaded weights as the countermeasure. It's kind of bulky. But then the other two use magnetic weights. The Steady 2 and the Ready Steady. Two different brands, very similar names. That again, these are just wearable devices that you wear on your wrist or your hand that dissipate the energy that comes with the tremor and helps stabilize hand movements. Then we get into tech that actually is aiming to alleviate the tremor. Use your brain to make the tremor go away, at least for a little while. Now, one that's been around, at least talked about, is probably one of the first generations of these that was talked about, what has now been dubbed the gyro glove. I remember reading about this as early as 2014, 2016, and then it just seemed to go nowhere. And actually, yeah, that's exactly the case. So what is the gyro glove? The gyro glove, it looks like those energy dissipators, but instead of using energy dissipation, it's actually using a battery operated gyroscope that helps to counteract the tremors and generate stability in the hand. So it's going to be a lot more responsive in real time to the tremors. And it's going to be able to stabilize things in 3D space to help restore the ability to do some of these tasks. Now, so this is what I remember seeing when they were first talking about it, like 8 years ago now. This is their most recent generation. Unfortunately, it seems like they've spent all this time continually perfecting their product and just raising money, because at the moment it is not approved for use, it is not approved for sale, and they're only now, I saw a report in 2021 or 2022 where they had finally raised enough money to start thinking about clinical trials, but I'm not aware of a clinical trial that's using this yet.
It's a hard question to ask, and I think I think there was also maybe some confusion as whether or not a clinical trial was needed, that sort of thing. And the other thing I want to point out is that for a lot of the tremor type of devices we're mentioning here, sometimes these are really built with essential tremor in mind. So this is more of a tremor that occurs when you're trying to do something, whereas more of a Parkinson's tremors when you're trying to not do anything. That's when the tremor tends to show up. And so I think that's been a real challenge for these companies, is to try and figure out, who's the target audience, or is there a way to, cover all kinds of tremor, with this type of device? I mean, theoretically, that's possible, but I think I think that's part of the slow up and getting these devices more into prime time.
And that actually makes sense, because when you read about the actual science of how this works, it really does seem that this would be better geared towards someone with essential tremor or, motion activated tremor, as opposed to somebody with resting tremor. Now, on the flip side of that, go ahead.
Well, I mean, for some people with Parkinson's, this can be a piece of their tremor. So it can definitely be a component, so that, again, it's when you're trying to eat and the tremor comes out, or trying to hammer or something like this. So it's, for some patients with Parkinson's, it is an issue, but the classic tremor that we talk about with Parkinson's disease is really, sorry, go to right there, it's fine, is really more of a rest tremor.
So the last two I showed you are really trying to dampen down the tremor at the point where it's a problem, at the hand. Now we're talking about actually using stimulation in the periphery to create neuromodulation that would actually make your peripheral nerve system, make your nerves and your brain stop causing a tremor in the first place. And there's several technologies out there that are aiming to do this. The first that actually is available is the Trio. Now, this is, like all the others we talked about, non-invasive, drug-free, an aid to those where the drugs aren't helping. And it's a wrist-worn treatment that elicits a little electrical stimulation. So just a really tiny electrical pulse that results in neuromodulation of the peripheral nerves back up to the spine and the brain. And the idea behind this is you would put this on and it would just pulse for about 40 minutes on your arm. And that helps reset the neuronal circuitry between your hands and your brain. And people have reported at least temporary relief after this 40-minute treatment that really reduces the amount of tremor that they're having. And the thing that's really cool about this is it can be tailored to the patient, just like a DBS. We can, program the rate of the pulses, the length of the treatment, to try to alleviate the tremor on a person-to-person basis. So this one is FDA cleared. This one is available for prescription. So it could be something you may want to talk to your doctor about if you're having issues with tremor.
This is an interesting, kind of a different approach that I think is worth looking into. And I will caveat this again. I think tremor isn't the main problem for everybody. This is really, again, but for not everybody does the medication work well enough to manage tremor. So this is really a place to kind of help with that.
So in the same vein, this is something that has been all over the news a lot very recently. So a group at Stanford University has been developing a vibration glove to try to help alleviate tremors. So this works on a very similar principle. So the gloves deliver just a very light vibration, just like a little tingle through the fingertips. And again, the treatment, it's using mechanical vibration instead of the electrical pulses like the calo, to cause this neuromodulation in the peripheral nerves in the nervous system. So again, with this idea that we can reset the abnormal electroactivity that leads to these tremors. So it's the same premise. You would wear these, you'd go through a treatment period, but instead of electrical pulses, it's just a small vibratory pulse. And because the way it's designed, you can also still use your hands and work while you're getting the vibration treatment. This one, however, I want to emphasize is still in development. So there's some papers were recently published on it. But it is yet another device that is up and coming. Now, another interesting story that goes with this, there's another product that is also being tested that uses vibration pulses. This one, however, is not a glove. It's more of a watch, wrist-worn device. That's also available, or that's also a wearable vibration device for Parkinson's disease. So this one, much like the electrical pulse, it uses a programmable series of pulses, of vibration pulses, not unlike the vibration that you would get from a smartwatch, to cause this neuromodulation. Now, this one was just published last year, and it is currently in several clinical trials. Now, the story that's really cool behind this one is David Petrino at Mount Sinai, who's developed this. He was actually originally working on a glove, just like the Standford group. He was competing with the Standford group to build a vibration glove. But while he was working on it, a friend of his that had tremor was curious about it. So he just took one of the servos off and just strapped it to his friend's wrist and noticed that his friend was alleviated. So he just abandoned the whole glove concept and just went to the watch size wearable device. So it's going to be interesting to see which of these works better when it comes to trials and neuromodulation and eliciting a measurable effect on alleviating temporarily alleviating tremors. Now the key point here is, none of these unfortunately are a cure for the tremor. They don't wear it for 40 minutes and then you don't have tremor for a week. In most of the cases, you wear it for 40 minutes and then you don't have tremor for a few hours. So it's a repeated thing, but compared to a lot of other treatments out there, this is pretty low impact, non-invasive, pretty easy to do in your daily routine.
I like it too, because when you take medicine, it's, it affects the entire body. Whereas something external like this, you can take it off and on. You don't, it's not, you don't have to do it, right? This is really to help if it's working, right? Yeah. So I think it's a nice alternative. Again, it's meant to supplement regular medical care. And again, if tremor is a big problem for you and the meds are not working very well. But I think it is very important. I'm glad to see that there are so many gadgets out there, because we really should be looking for other ways to help, with just quality of life that's not just getting more medicine. And that's one thing I really always like about thinking about these gadgets, and to see this sort of resurgence and this interest has been really, really cool. I do want to say it's hard to put these things into clinical studies. It may not make sense, but it's actually hard to measure tremor, and then to be able to then say it works here and doesn't work here. It's actually a very difficult question to answer, because we don't have the perfect way to say this is tremor, this is not tremor, just from a measurement standpoint.
And accordingly, comparatively speaking, when we say that these kind of devices are in trials, generally these are lab run trials where they've recruited 40, 100 people and ask them to use the device and do self-reporting. These aren't the large clinical trials with a lot of biomarkers and everything like that. So So these really are meant to be more aids. Now, when you bring up the topic of whole body, however, that immediately raises the question, well, if vibration can work on my hands, why can't it work on my whole body? And people are trying that. Actually, just as long as people have been trying to make the wrist devices since the early 20 teens, people have been testing out this concept of whole body vibration therapy. Can we just, pulse the entire person and create neuromodulation that helps reset movement disorder symptoms, movement symptoms. And so this is just one example of one of the whole body training devices where you would stand on this platform and it just vibrates in pulses over a given period of time while the person stands there. There are other ones that look like the old, 1940s body shakers that wrap around you and shake the entire body and everything. The old quack weight loss devices. So there are clinical trials and multiple studies ongoing looking at whole body vibration. The problem we're having with this, however, is that it's really, as Amber has said, it's really hard to evaluate this therapy. For one thing, almost every study is using a different device. For another, like, it has to be programmed to the patient. And the results that are coming out from these studies are very highly variable. Some are showing that there's tremendous benefit. Some are showing that there's no difference from placebo. I don't really know what your placebo is for vibration, but
This is the complication in putting these types of gadgets into studies. And we're really relying on self-reporting, which from the FDA and other regulators, that has some validity, but when that's hard to measure. And then you get into like, is this different than placebo? And that's where things can get really off the rails and the variability is high. So anecdotally, people who've had some experience with these different gadgets, I think will tell you, oh yeah, it worked. But to try and prove that in a real rigorous scientific way is very hard.
As of right now, it would appear that temporary alleviation from things like the electrostimulation and wrist-worn vibration stimulation seem to be more consistent than the whole body. There's a lot of back and forth when it comes to the whole body. So we'll just keep an eye on this one for now.
We have some good questions coming in.
Okay. This is a good pausing point. So
why are the devices called training? It doesn't seem that the effects are expected to persist after the application.
Well,
good question.
Persist depends on how you define persist. And from a medical and scientific standpoint, anything that lasts longer than the treatment is persisting. And so what's happened is during that 40-minute period where you're wearing the device, you've trained your nervous system to work on that pulse, and it'll keep going as long as it can maintain that pulse. The problem is we haven't really fixed the root problem, the signaling inside the brain. So eventually, it's just like two car blinkers that are just slightly off. They're going to be in sync for a while, but eventually they're going to get off sync again, and you're going to be back to tremor. Now, the idea here is if we can get train the brain to stay in sync train the brain to be in sync long enough that will carry over to several hours of alleviation. But this isn't the kind of training where we're actually rewiring the brain. It's more just changing up the signaling pattern and that is only going to hold out as long as the brain can keep up with the new signaling pattern.
I mean, this is also, you could say the same thing about medicine, right, it doesn't last either, right? I think the reasons behind it are a little bit different, but this is again why, it doesn't persist. I think there's a good question out there, and I'm guessing they're trying to ask themselves this, does it persist longer if you do it more and more? So it may, again, going to this training idea, if you can really train the brain by doing this very vigorously, does that have an impact? I don't know, but I'm guessing this is what they're trying to look at.
That's exactly right. So that's why a lot of these devices have been made so that they're programmable, because
Mm.
the same pattern may not work for each person. So it's half tailoring it to the person, half tailoring it to the basic mechanisms of the disease. So yeah, when we say training, yeah, it is training, but just like certain things that we train ourselves to do, if it doesn't keep up, we lose it eventually. Any other questions?
Yeah, there's another one with the vibration. I actually just love that they're bringing back old is new again type of of devices. But are there any vibration or stimulation devices being created for freezing of gait?
Ooh.
I happen to do. You go first.
I don't know. So if you know something, please.
Yeah, it's a really good question, and I think the hard part with freezing of gait is it's harder to predict, and it doesn't happen all the time. So I think there is some work in trying to find devices that can be stimulated when you need it. And so maybe it's not, I don't know if a vibration, but yeah, stimulation I think is appropriate. I think it's a matter of, do you do that on an ankle? Do you do it on the arm? Like how do you stimulate? Where do you stimulate? How much do you stimulate? But yes, absolutely. There is a lot of work being done on this right now. And in part, again, because the freezing of gait is another symptom that is not well addressed. It's not adequately being managed by just levodopa. And for a lot of patients, the medicines themselves don't help a ton with freezing of gait. Sometimes it does.
And
So
this could be in part. This could be in part because the mechanism that causes freezing of gait is a little bit different than that causes
still figuring it out.
tremor and rigidity. Because it's when we walk, it isn't just about voluntary movement. It's voluntary movement with audiovisual cues.
We have a lot of there are programs built into your spinal cord and that then talk to the brain, where some of the walking is automatic. We can actually see this in animal models where there are programs already built into your nervous system to help with walking. To some extent, that's automatic, and that freezing is when that automatic part doesn't work anymore.
Right. So that's why, like, some of these audiovisual cues help hijack the
Yes,
system
exactly.
and go around it to tell your brain, hey, I can't talk to your spine right anymore. I'm going to talk to your eyes and say, hey, go to that spot.
Exactly.
But yeah, that's actually an excellent point. Rats are an excellent example of there being hardwired programming. Rats are front wheel drive. If you hold a rat by its hind legs up in the air, it'll keep walking on its front legs. If you hold a rat up and make it stand on its hind legs, it just stands there. It doesn't know how to walk anymore.
There was a question about steady mouse. I don't think we included that one in here, so I don't know if Karen, if you want to say anything more about that.
Yeah, we didn't include that one in here, so
It's a good idea, though. I don't know if anyone else has tried it or familiar with it. I see Donna has her hand up.
yes, I see that. Hi, Donna, what's up?
I wasn't bringing, I was just going back to the subject of vibration. And I've been looking at a lot of functional medicine type things, and they talk about body meridians and changing your fascia. Your fascia is around your whole body. It's your electrical system around your whole body. And then delivering, adjusting the electrical system through resistance training or vibration on certain meridians leading to the brain. And I mean, do you guys know about that? And how does that tie into what we're seeing here?
To me, this is there are nerves that are in the fascia. There are nerves that go to our organs. There are nerves that go everywhere. But the fascia itself isn't nervous tissue, right? But it is innervated. So there are nerves that go there. So what we're talking about is we're using different terms, but we're kind of saying the same thing. So we're talking about the peripheral nervous system. So this is the touch and feel that you can feel the vibration in your arms and legs. those nerves are different in a lot of ways than the nerves that are inside your brain or in your spinal cord. This is the central nervous system. These are the peripheral nervous system. And there is obviously a lot of talk between the peripheral and the central nervous system. And I think, and what we're really saying is, this vibration, especially, is a great example of stimulating the peripheral nervous system to then have an effect on the central nervous system. So, I mean, I think meridian is a great term that's not based in the science, let's say here, but it has the same, it basically means the same thing. But I think we're really pushing the peripheral nervous system here to help us modify what's happening in centrally. And Donna, this is the best I can do to try and tie these two things together. But I think it's just a semantics thing.
But the body meridians, and they show them on the body. Does the medical Western medicine address these body meridians, or that's not a concept in medicine?
It's not. Yeah, this is more Eastern Chinese medicine, especially is I think where I hear most of this. Let's put it this way: it's not taught in medical school.
Okay, and then
But I think this is it's the same thing. It's a peripheral nervous system is what we're talking about.
The other biohack that happens with vibration is for your bone density and increasing your bone like
this is true.
When you go to OsteoStrong, and before you apply resistance, like for your bones, they put you on a vibration board. And when my sister was going to OsteoStrong, I mean, it helped with everything, her Parkinson's, her balance. So just standing on a vibration board, get your body ready to accept whatever they're doing at OsteoStrong with these exercises once a week. And over time, so that's another biohack where vibration is being shown to work.
Yeah, actually, I had a broken bone once that it took a long time to heal. And this was actually one of the therapies they had offered. So you are spot on. You have to stress the system a little bit, and the vibration sort of like a mild irritant, let's say, that is causing the bone to rebuild. And I think that this might be a similar type of property that we're trying to do here. It is a hack. I love putting it that way. I think that that's a great way of putting it. And I think because the way the brain is built, and there's so much redundancy, that we're just trying to work around to help alleviate these symptoms.
So in the interest of time, we probably better move on to the last part here. So as we have talked about, these were wearable techs to help mitigate symptoms, alleviate symptoms. But where tech has really been important, at least from the biomedical field, is being able to monitor symptoms. So how can we, as Amber had mentioned previously, it can actually be pretty unreliable. A lot of places don't really like using like the self-reporting. I mean, we used it for years for clinical trials, but being able to know what's going on with a patient, with their symptoms, how they're changing, is absolutely crucial for a doctor to be able to provide effective treatment for that patient. Similarly, it's absolutely essential for doctors and clinical trial runners to be able to get that data to know if these novel treatments are actually working in their patients. And self-reporting has various issues. There's variability. It can be time-consuming for patients. What is an off time to you may not be an off time to her, may not be an off time to your doctor. So, all of these things can really complicate this. That's where wearable tech comes in, because it's unbiased. It's programmed to record, this is off, this is on, this is tremor, this is a fall. And it can collect all that data simply by you wearing the device and transmit all that data to your doctor for assessment. There's no time commitment by the patient beyond remembering to wear the technology. And it's just far more standardized measurement and a much more global collection of symptom data, because now you're not just reporting one or two things that you remember to write down in a diary. It's collecting everything, depending on what the device is. So I'm just going to run through several of the devices. There's a whole bunch of wrist-worn devices that have been approved for FDA. These have been around for going back 10, nearly 20 years, since the dawn of the smartphone age, for being able to measure these symptoms and transmit the data. Some of the most common ones that have FDA approval are the PKG, or the personal kinetograph, which just looks like a watch, smartwatch when you wear it. There's the motion watch, very similar technology, and it's often paired with what's called a pro diary, basically a wearable smart screen on your hand that you can rate things and just keep the diary that way, so you don't have to stop and write things down. And then several devices for just measuring typical movement and tremor and falls. Two examples here that I point out are the ViMove and Stepwatch, that have been approved for about 8 years now for use in medical trials. And these are all great for monitoring basic movement, rigidity, tremor, things like that. But now, as clinical trials mature, as drugs and treatments for symptoms progress, we need more. We need to know more. And there's a lot of things coming out now to try to get more data more efficiently, organized better to the places it needs to go. And one of the interesting ones that just got FDA approval is this Strive PD. Now, it's actually not a device. It is just an app that takes advantage of devices you're probably already wearing. So if you have an iPhone and an Apple Watch, it's actually already got all the different measuring devices in it to measure movement, rigidity, falls, blood pressure, everything like that. And this app can then, so your watch will measure all of the same stuff that all those devices I just pointed out would wear. And then that pairs with an app on your phone that serves as a digital diary. And this can all just be sent in. And then you're not having to get any new tech. You're not having to wear 2 watches or carry a separate tablet or anything like that. It just is an app that goes right on your phone. And then that can be shared straight to your doctor or clinical trial professional. And as I mentioned, this one just got pre-market clearance, so it can start being used in clinical trials to measure patients' symptoms.
One of the biggest, this was a big deal. And I think that there was, it's the second bullet point here, that you can do this communication with your physician, that I think has been really appealing, so that you can go in to your neurologist and you can show them, I don't know if you can see this like color coded screen here, and you can say, man, Tuesday was a terrible day. You can see like I took my meds here, and here, and you can still see I've got tremor, or this isn't working, or it's a visual way of trying to help your doctor see how you're doing or how your meds are working. And I think the idea here is that it will help with managing how you change medication regimens or not. And I think this was also what some of the feedback I've heard too is it feels more empowering, like you have some better degree of control over understanding and managing symptoms. So I think this is kind of unique in that way, in that it's very you have to really put a lot into it to get a lot out of it. But we're going to start seeing this in a lot of clinical studies coming up. So just watch for this one.
For example, like while this is again just a personal diary and this component of the app, the benefit is because it's on your phone and digital, you can actually put a schedule into it. So you can schedule in when you're supposed to take your meds, when you're supposed to, like, if you're going to take a walk. And instead of you having to remember, oh, I need to write down that I took my meds, or, oh, I need to write down that I'm having an off period, it will remind you. It will tell you, hey, did you take your meds? And then you can put in, I took 2 pills of Cinemet at 6 p.m., just like it said. And then the watch will record all the movement data, and that all that information can then be paired and looked at in this visual table. So
I need to add, because this is one downside. I mean, the slide before just showed several devices. I'm gonna tell you, that was like a fraction of what's out there. And one of the things that is a sticking point right now is that we can get tons of data. We have so much data, we don't know what to do with it, and it's hard to interpret. And so this has been something that we're just really starting to get a handle on. What does this data mean? I think we're still trying to figure this out for all these different devices. So
I think tech like this is going to help step that up, because now we can start getting the data in a way that it can be paired with other data and visualized. And you're not just looking at numbers and schedules. So this is a step forward. It'll be good.
Yeah.
Oh, I'm frozen. Hold on a second. There we go. Also, the type of wearable devices are also progressing. So one that is currently recently got FDA cleared is this PAMSys wearable sensor. It's not too different from the others, but it can measure a lot more. And it can also be worn different ways. So it's not one that has to be on the wrist or has to be on the ankle. You can just wear it around your neck like a necklace. And can look at and can just do continuous monitoring. It has a really long battery life. And you look at physical activity, it can look at sleep, it can look at posture, gait parameters and falls. So it's not terribly different than the ones that I started out with, but it's just kind of like the next generation and just incorporating more and more data. And again, pairing that with an app system that can process the data in a way that's meaningful. And this is another one that is FDA registered and being used in clinical trials. So what's the next step from here? Well, the next step from here is data from everywhere. So a lot of the devices that we've been talking about are primarily going to look at gross motor movement. So how much are you walking? How much are you falling? How much are you sleeping? Things like that. But there could be issues with very fine motor movement, rigidity that we're missing because it's just beyond the detection level of the tech that we have right now, or the tech that you can build into a smartwatch. And so there's this group at Harvard at the Weiss Institute that's actually working on what they call their MyoExo wearable sensors. So these are tiny little flexible sensors that the idea is they would actually be built into clothing, comfortable wearable clothing, but that the sensors would then give back very fine detailed data on muscle tone, muscle use, much better reporting on rigidity with basic movements. And this would just help fine tune the data that we're already getting from like the smartwatch type wearables. Did you have any comment on this one, or?
Yeah, no, I think I've seen some of this come through. I'm seeing this in not just the arm. There's I think other ways to use this kind of technology for symptoms that are in other parts of the body. I just wanted to point that.
Yeah, and they're looking at this for beyond Parkinson's, but that's that's the area they're coming from. So this could be used, in other motor diseases like muscular dystrophy and multiple sclerosis and so on. So, well, let's say you're a person that doesn't like wearing these things or can't ever remember to put your smartwatch on. So what if you didn't even have to remember to put anything on? You're just being monitored. You didn't have to write down a diary. You didn't have to put on a watch. You didn't have to make sure it was charged. And that's going to be the true next gen. This, what we call passive monitoring. You're just being recorded. Now that sounds creepy, but let me explain. So one of the techs that has just come out is what is called this Emerald device. And this is tech that you don't wear. You live with it, but you don't have to wear it. You don't have to remember it. You don't even have to think about it. So what this is this is just a panel that gets hung up in your house, typically in the bedroom or in the living space. And it uses radio wave detection. So there's nothing visual being recorded here. There's nothing that can be reconstructed visually going on here. It's just using radio waves to sense slight changes in movement in the room. And that data then gets transformed into data about gait, about movement, about falls. And that can
They
be
can
used.
even pick up sleep and heart rate and breathing patterns, that they can actually distinguish breathing patterns in someone in sleep that has Parkinson's and someone who does not. It's
And
fascinating.
that's crazy.
Yeah.
Again, this isn't like a stalking device. There's no way that this can be recreated into a visual map. Right? It's just recording these very small radio wave changes that are caused by your body just existing, and turned into measures of what is your sleep rate, what is your heart rate, what is your gait. And then the idea being that you can just put the sensor one place in your house, because radio waves can travel through anything, just about, and then you get monitored as long as you're inside your home. And this can tell us changes about disease severity, changes in disease progression. Again, this would have to be paired with a diary so we can look at medication effect on motor symptoms. But this takes the person having to remember something out of the picture, and it's just continuous monitoring. So some people like to take their watch off at night when they sleep. Now we've lost 8 hours of data. This will give us that data. You don't have to do anything.
We know clinically, like what we see from patients when they come into the clinic, and they're a lot of times people want to show off a little bit. We're used to that. And then I'm being told he's not really like that at home. So this is one really great non-invasive way to see that to some degree. This is another issue though of like a lot of data coming in and trying to figure out how to interpret and know what to do with this information. And I think putting this into clinical trials is a great way to help advance this technology and help us make better drugs. I think this is one really important way to help us with that. And there was a comment here that, Emerald's a great idea for, particularly helpful for someone who lives alone. And yes, I think so. I mean, the one caveat here is you don't really interact with it. It's very, very removed in that way. But it is a great way to know what's happening at home, because the bulk of the day-to-day is that at home. It's not in the doctor's office.
Yeah.
And so this is one way for us to really better understand. And I'm hoping this will mean that we're doing a better job at making better medications for our Parkinson's patients.
And that's all I have for today. So we still have a couple minutes if we want to run through some questions real quick.
Yeah, there's one that just came through. And Don, I just wanted to check, did you have your hand up earlier for something else that you needed to ask?
I was just asking about Strive PD. I heard that they were giving Parkinson's patients Apple Watches for a study.
Some of this, there are, I think, multiple studies right now that are incorporating the Strive PD. And you'll have to talk to the different the studies directly. But yes, in some cases, if they want to study this with, incorporate this device or this technology into their study, in some cases they will provide an Apple Watch. Now that's not everybody all the time, but I do believe there are some studies out there looking at that.
Are any of our movement disorder groups getting this information from patients in Pittsburgh right now?
Ooh, it's a good question. I actually don't know. I will have to find out.
Because I think it originated out in California, right?
Yeah, correct. This has been the Strive and the Emerald. These are a lot of years behind this. I do need to run to my next call, but I wanted to answer your other question, Donna. So I read there was a study that said they could diagnose Parkinson's just by a breathing pattern at night. And I think it's actually a combination of breathing pattern and heart rate is how they did it, if I remember correctly. But yes, they can distinguish. If there are multiple people in the home, just having those radio waves going through, they could always tell who the patient was that had Parkinson's and who was the spouse or who was living in the house. It's crazy.
But was that a way to diagnose Parkinson's early rather than ruling out everything else?
I think that's what they're asking from this.
Yes.
And it's
They
a
actually have a
hard,
clinical trial to see if it can distinguish early Parkinson's from later stage Parkinson's, and even try to enroll patients they think are pre-Parkinsonian to see if they can catch it at that
Mhm.
stage from control patients.
fascinating stuff.
Thank you, Dr. Van Laars. Thank you for everyone for participating.
Happy New Year.
Yeah.
Happy 2023.
Happy New Year. We'll see you next month.
All
Thanks,
right.
everybody. Have a good weekend.
Thank you. Bye.
Bye.
Bye.